Moving on to the side effect of post-ligation procedure. After surgery, patient will be observed for a short time to be sure that there are no complications. Most women can go home within 2 to 4 hours after the procedure. They may feel some discomfort or experience other symptoms that last a few days, such as dizziness, nausea and vomiting, shoulder pain, abdominal cramps, bloated feeling, or sore throat. Sore throat may occur if the anesthesia was administered through the breathing tube. Most women return to their normal routine within 1 week of surgery. Post-tubal ligation syndrome often occur as a result of rapid decline of estrogen or progesterone as the blood supply being damaged to the ovaries during the tubal ligation procedure. Depending on the damage to the veins and capillaries, blood volume to the ovaries may slightly decrease or eliminated, which is also called as isolated ovarian syndrome, which is commonly occur in hysterectomy operation. Other theories of post-tubal ligation syndrome: target or receptor cells that are important in the relay of hormonal messages are damaged, destroyed, or removed during the tubal ligation surgery. It is possible for a woman to have both her ovaries still functioning to some degree, no major problems with her uterus, but still experiencing post-tubal ligation syndrome in the form of hormonal imbalance that is caused by change in her hormonal message relay system due to receptor cells being removed. Some of the symptoms of post-tubal ligation syndromes are associated with hot flushes, insomnia, reduced sexual activity. Other symptoms such as heavy, painful periods may be caused by hormonal imbalance that is due to adenomyosis, which is damage of uterus muscle and tissue. Irritability and mood disorder may also occur due to post-tubal ligation syndrome. In conclusion, tubal ligation is indicated for permanent sterilization. Hence, patients need to be informed about all the benefits and risks of the procedure. We hope that you get the benefit from our video. Thank you.